Andhra Pradesh allopathic private medical care establishment rules and regulations. That part 7 includes C. Essential equipment. The list of equipment given below is the minimum requirement the private all the private medical care establishments. A. Cards. It is essential to have patient cards with a hard base because it facilitates cardiopulmonary resuscitation when the need arises. B. Adequate linen should be clean and changed at regular intervals. C. Examination table. D. Emergency light. E. Stethoscopes and BP apparatus. F. Ophthalmoscope. G. Knee hammer. H. Measuring tape. I. Torch light. J. Weighing machine. Adult and pediatric. K. IV stands. 1. IV stands. 1. L. Wheelchair. M. Oxygen cylinders. At least 2 with flow meter and mask or nasal prongs. N. Laryngoscope set and endotracheal tubes. O. Suction apparatus. P. Resuscitation bag, that is ambo bag. Q. Sterilizer. R. Drums to carry out sterile dressing and instruments. S. Bedside toilet equipment, urinals, bedpans, etc. T. Bedside screens, that is U. Thermometer. V. Tongue depressors. D. Essential drugs and consumables. The list of essential drugs that should be available at any point of time are A. Adrenaline, B. Atropine, C. Aminophylline, D. Chlorpheniramine, E. Hydrocortisone and dexamethasone, and F. Furosemide, G. Soda bicarbonate, H. Dopamine, I. Mefentine, J. Calcium gluconate, K. Pentazocaine or pethidine or any other analgesics. I. L. Diazepam, M. Hemostatics like ethamycilate, streptochrome, and botropase. N. IV fluids. Dextrose 5%, 10%, 25%. Dextrose saline, normal saline, electrolytic solution, adult and pediatric, and plasma expanders. Say hemaxil O. IV sets and IV cannulas, adult and pediatric. P. Scalp vein sets of different sizes. Q. Syringes 2, 5, 10, 20 cc. Disposable or sterilized. R. IV mannitol 10%, 20%. S. Antiseptic solutions. Dettol, Savlon, Spirit, Betadine, etc. T. Plaster and bandages. E. Operation theatre. Operation theatre is the nucleus of any hospital and deserves special care and attention. There should be no compromise on the following aspects in an operation theatre. A. A clean and spacious room, minimum of 120 to 200 square feet, sealed off from the surroundings. B. Complete asepsis should be maintained. C. Adjustable theater table for different manipulations, either hydraulic or manual. D. Overhead theater light or mobile shadowless light. E. Electrosurgical unit. F. Suction apparatus. G. Anesthesia machine. No surgery, including under regional anesthesia, should be performed in the absence of anesthesia machine. H. Adequate supplies of gases, especially oxygen. I. Bamboo resuscitation bag. J. A high pressure autoclave. K. Linen and instruments depending on the nature of surgery. I. Laryngoscope with adult and pediatric blades. M. Pediatric anesthesia circuit. N. Endotracheal tubes at different sizes. Endotracheal tubes of different sizes. O. Spinal anesthesia sets. It is advocated to use disposable spinal needles and syringes as they are reasonably cheap now and will go a long way in preventing some of the dreaded complications such as infections. P. Stretcher with trolley for shifting patients. Q. IV stands and IV administration facilities are in hospitals performing cesarean parts. It is essential to have the neonatal resuscitation kits as mentioned in the maternity services item as drugs adrenaline, neostigmine, aminophylline, pentyl sodium, succinylcholine, galamine, pavulan, pentazocaine, diazepam, xylocard, xylocaine, 5 to 1 percentage, hydrocortisone, chlorpheniramine, dexamethasone, dopamine, mecfentyne, furosemide, mannitol, ether, halothane, soda bicarbonate, deriphyllin, metoclopramide, promethazine, IV cannula, IV sets, scalp pain tubes, xylocaine jelly, antiseptic solutions, IV fluids, hemaxil, and airways. T. Proper facilities should be available for scrubbing. U. Air conditioned. F. Labor room. This is one of the most vital areas in a hospital providing maternity services, and there should be no compromise on the following aspects of the labor room. A floor area of minimum of 120 square feet. B. All precautions for asepsis must be taken. C. Good illumination with overhead OT light. D. Electrical cautery and suction apparatus. E. Stethoscope, BP apparatus, and weighing machines, adult and pediatric. F. Resuscitation equipment and pediatric resuscitation equipment, that is, pediatric resuscitation bag, endotracheal tube. Number 2. Laryngoscope with neonatal blade, stomach tube for infant feeding tube, etc. G. Oxygen cylinders with connections and masks. H. Delivery table with basic manipulations. I. Autoclave. J. All emergency drugs as in para D above. K. IV stand and IV fluid administration facilities. I. Stretcher with a trolley for shifting patients. M. Forceps for delivery. Para G. Important zoning requirements of the different functional areas. 1. Ambulatory zone. The ambulatory zone will have the following functional areas: 1. Medical clinic, consultation and examination room with waiting area. 2. Surgical clinic, consultation and examination room with waiting area. C. Casualty and emergency care, which is optional. 4. Treatment and dressing. And 5. Injection room. Obstetric and gynecologic clinic. In case of maternity home providing obstetrics and gynecological services, to have the clinic as described below. The clinic should include a separate registration, consulting cum examination room and toilet in order to ensure privacy. The clinic should be planned close to the inpatient's ward units to enable them to make use of the clinics at times for anti and postnatal care. The clinic should be at a convenient distance from other clinics in the outpatient patient department. 2. Critical zone. This zone is required in surgical and maternity homes. This zone consists of the operation theatre and delivery suite. This is technically a therapeutic area in which a team of surgeons, anesthetists, nurses, gynecologists, and sometimes pathologists and radiologists operate upon or care for the patient. The critical zone shall be located and arranged to prevent non-related traffic through the suites. When delivery and operating rooms in the same suite, access and service arrangements should be such that neither staff nor patients need to travel through one area to reach the other. 3. Operation theatre. Protective zone consisting of nursery station with storage facility, changing rooms. Staff arrive through this zone and proceed via changing areas dressed for their task. Green zone. This includes the recovery room. It is principally the corridor linking the transfer bay to the theatre suite. Patients are brought from the ward and should not cross this zone in their ward. Clothing, which is a great source of infection. Changeover of trolley should be adjusted just before the green zone. Aseptic or sterile zone. It consists of the operation theaters, sterilization, theater pack preparation, and sterile storage, scrub up, and gowning rooms. Disposal zone, also erroneously called the dirty zone. Soiled instruments and dressings are transacted through this area for washing and sterilization or disposal. 4. Delivery suite, required for nursing homes providing maternity facilities. All maternity homes and all nursing homes offering maternity services shall make provisions for a delivery suite over and above the aforementioned facilities necessary for an operating suite. In maternity homes, an arrangement must be made to isolate a patient of eclampsia. 2 labor rooms should be provided for every 10 maternity beds or part thereof. These rooms may be constructed preferably in the form of cubicles. There should be they should be close by to the delivery room. In case combined with the examination and preparation room, the area standards should be maintained. These rooms should ideally be suited close to the operation theater. The rest will be continued in the next video, that is part 8. Thank you.